Hello everyone, my name is Melissa Trout. I am a bachelor's prepared RN. I work for the New York State Education Department currently. I am also enrolled at Roberts Wesleyan in the Master's in Nursing Administration program. I am here to talk to you today about the future nurse leader, the quadruple aim, and the 21st century nurse. Let's talk about what the 21st century nurse leader should have as far as skills or qualities in this role. A 21st century nurse leader should be a visionary individual. This is someone who can envision new innovative ways of doing things in the current clinical setting in which they practice. This nurse leader with this vision should be able to communicate very effectively with the staff on what that vision looks like and how that will be implemented in rolling that change in practice out. A nurse leader should be an individual who can influence others. So that can be to influence others to try new things, use evidence-based practice, work on technology that maybe they're not comfortable in, such as Office 365, and then to support them in being successful in the use of those elements that they are not comfortable in. A nurse leader should be a motivator and a mentor. So this would be an individual who would motivate others to push themselves outside of their comfort zone. This could be going back to school to further their education and mentoring them in doing so. A nurse leader should also represent a teamwork ability or effect in the setting while also maintaining management duties. So this would be the nurse leader who would, while out at the nurse's station, answer call bells, go to the patient's room to see what they need, provide them with whatever it is that they're requesting, and showing that they are part of the team, that working at all levels creates that team culture, while also maintaining a tight run ship in the management, so making sure that the standard of care is at the level that it needs to be at. Next, let's talk about moving from triple to quadruple aim. Moving from triple to the quadruple aim, we're always working toward being successful at better health, better care, and low cost. So let's talk about each of these individually. By better health, we're talking about improving population health overall through both our patients and their family members by providing education and tools that they can use to help manage their own care and their own outcomes. And then we're striving to provide better care to enhance our patients' experience through high quality, effective care. This becomes tricky when we're considering the third component, which is lower cost. Due to the continuous rise of medical costs, it becomes a juggle to provide the most innovative, cost-effective, quality care. Some individuals feel that the fourth component in the quadruple aim should be filled as a title of equality. Others feel the title should be organizational preparedness. I personally feel that joy at work should be the fourth component in the quadruple aim. A work-life balance is crucial in our nursing profession due to the burnout rates currently being astronomical. Work is hard, so creating a nice work environment to allow enjoyment while being there will increase sustainability of staff. This can be done through providing staff with an opportunity to share ideas and recommendations on how processes and workflow could be improved in our clinical setting. This can also be done through providing staff with appreciation and recognition for all that they do, and then also through giving compliments to staff whenever and wherever possible. By doing these things, this creates an engaged and positive staff environment. Then staff will feel the meaning in what they do in their day-to-day job, which will also provide them with a feeling of being valued, and it validates the importance of their role as a team member. And for the last segment, we'll talk about the future nurse leadership. I actually picked the quote, "Act like a nurse, think like a boss." I thought it was very fitting and suiting as what the future nurse leader should look like or resemble. I feel that nurse leaders should practice to the fullest extent of their education and training, and a leader should provide opportunities for other nurses to lead and share in improvement ideas and efforts. To be a leader, one should promote and encourage other nurses to be lifelong learners and prepare and enable other nurses to lead change to advance health in an improved forward motion. The future nurse leader will require some traits. Those will be in the use of technology. As technology continues to advance, we as nurse leaders need to maintain currency in how to utilize the technology that's at our fingertips, as well as evidence-based practice. So this is the nurse leader encouraging or supporting, as well as role modeling the use of evidence-based practice in their clinical setting. Again, one of the other traits for a future nurse leader is the continued learning. Not only as nurse leaders should we continue our education in order to be cutting edge and stay on top of the most current practices, but we should also encourage and support continued learning throughout our staff as well. A trait for a nurse leader that will be valuable will be to be an visionary, to see and think outside of the box on different ways to manage workflow processes. How can we create a smoother workflow, more time efficient, more effective way of doing things? And then to be able to adapt to change is another quality or trait that a nurse leader will need in the future. Our health care system is on a continued evolvement of change, and being a nurse leader, we really need to be able to adapt to a rapid change such as that. Another really important quality for a future nurse leader is to create a culture. So that is by setting example, create that culture of mentorship and learning on your clinical unit that'll support each other to work together collaboratively as a team. This is done through allowing and encouraging questioning, learning opportunities, so that not one nurse feels that they are outranking another nurse. We're there to work together, so it's not the seasoned nurse eating the young nurse. It's working as a team to meet the needs of the patient in a safe, cost-effective way. All of these traits and skills as a future nurse leader will ensure a high-level quality care for our patients in a safe, innovative, cost-effective way. I hope you enjoyed this presentation, and I thank you for your time and watching.